Our chapter on hepatitis viruses. This chapter is relatively unique in the textbook because most of the other units in the textbook are about one particular type of viruses. And the hepatitis chapter, now we're looking at a syndrome, right? A set of signs and symptoms and all the viruses that cause it. So unlike the other units, we're going to look at viruses of diverse taxonomy, and they all cause hepatitis. So historically, some of the names that we're working with here are named. This vocabulary was developed before we had a really good feel for the molecular biology and the virology behind it. So all hepatitis, no matter what the cause, is inflammation of the liver. And the classic symptoms of hepatitis are going to be inflammation in the liver and jaundice, right? So you have a yellow discoloration of the skin, possibly the eyes, and really dark urine. Now, hepatitis can be caused by lots of different viruses, but also other conditions like alcoholism or some prescription drugs. There have been a lot of outbreaks of hepatitis throughout human history for the viruses that are foodborne. We've had big outbreaks. Military campaigns have been brought to their knees by hepatitis, and we've had outbreaks where this gets into the food or the water, and lots and lots of people get sick. Now, we've got two broad categories of hepatitis. Serum hepatitis is bloodborne, and these viruses are transmitted through sharing needles or any other type of blood-to-blood contact, could be sexual contact. Infectious hepatitis, this is through contaminated food or water. Now, I really do not like the term infectious hepatitis because your bloodborne hepatitis are also infectious, right, if you have blood-to-blood contact. But this is the vocabulary that's been historically used. Now, primary hepatitis is going to occur right after an infection of the hepatitis virus. Secondary hepatitis comes after some other disease or treatment that causes hepatitis. So in this chapter, we're going to focus primarily on viral primary hepatitis. So we've got lots of different hepatitis viruses, and these were all named in the order they were discovered. We've got A, B, C, D, E. We're noticing that there's a gap here. There's no F, G, and then I don't know why they switched from going alphabetically to we've got TTV or toractinovirus and sentinel virus. Now, the reason we don't have a hepatitis F, this is because they thought several years ago that they'd found a hepatitis F, but then they realized that virus, it was never substantiated, and so nothing ever came of that. And so rather than, say, all right, well, the next new one we find will be F, to avoid confusion in the literature, they just kind of retired the F for hepatitis. Notice that all of these viruses, they come from different categories, right? Coronavirus, this is going to be like poliovirus. HepatinoDNA virus, this is the freaky virus that it has a DNA genome but has a RNA intermediate with reverse transcriptase. Flaviviruses, Hepaviridae, Flaviviridae. So I guess we've got two on Flaviviridae, Cercoviridae. Now, these viruses down here, we still don't know a lot about these, and we don't really know, like hepatitis G, we don't really know how strongly associated these are with diseases. So these are still kind of under investigation. So we're going to primarily focus on the first few, A through E. So how are they transmitted? This is a very important table for you guys to know. 10.2. Hepatitis A, it's a fecal oral, and it's going to be in fecally contaminated water or food that has been washed with fecally contaminated water, or rarely food that's processed when somebody hasn't properly washed their hands. This virus, hepatitis A, does not cause chronic infection. It's an acute infection. So you get sick and then you get better. It's self-limiting. There is a vaccine available for hepatitis A. Hepatitis B is spread through blood contact. This can be spread from mother to child during childbirth or shortly after childbirth. This can also be spread through sharing needles and so forth, some sexual contact. But this virus, any type of blood contact, and this can cause chronic infection, and the rate at which it causes chronic infection depends on age. There is a vaccine available for hepatitis B. Hepatitis C is not spread through fecal oral contact. It's spread through blood contact like B. Right, so hepatitis C through any type of blood-to-blood contact, sexual contact, sharing needles. Now, this used to be actually in the blood supply, but they screen for it now. But this can have a long incubation period, and so before they started screening for this, the early 90s, actually, I think, this was spread through contaminated blood products. But now, we screened for it. But there is no vaccine. They're working really hard, but there's no vaccine for hepatitis C right now. All right, hepatitis D. This is interesting because what hepatitis D does is it makes B worse. Hepatitis D cannot cause infection on its own. It's a defective virus, so you can think D for defective. Spread the same way as hepatitis B. We don't have a vaccine for this. Hepatitis E, like A, is a fecal oral through contaminated water, contaminated food that's been washed with contaminated water, or a bad processing of the food. There is a vaccine available for this, they have designed a vaccine, but it's not available in the United States. This does not cause chronic infection, but it causes a more severe acute infection. And then hepatitis G, TTV, and sentinel virus through blood contact. There might be contamination in the blood supply for sentinel virus. We don't know. Not really associated with a lot of known diseases. So these last ones we've got question marks. We still don't know for these last three. Okay, so we're going to go through all of these hepatitis viruses individually now. So hepatitis A virus, again with contaminated food, contaminated water, contaminated shellfish, fecal oral. Now, the average incubation period is pretty long, so you go on vacation and you have a great time on vacation, but you weren't vaccinated against hepatitis A because, I don't know why, your travel nurse should have given you a vaccine for hepatitis A, but let's imagine you weren't. You go on vacation, you have a great time, you get back, and a month later, you get pretty sick. This is more severe sometimes in adults than it is in children. So notice the jaundice, the discoloration of the eyes. It can have pretty severe abdominal pain, loss of appetite, nausea, vomiting, and but this usually goes away, right? So this is self-limiting. So after a week or two, you feel better. Hepatitis B. This, thankfully, due to a vaccination campaign, is relatively rare here. The Hep B vaccine is the very first vaccine that babies get, and that has really dramatically reduced the incidence of hepatitis B in children, and has been a really big help in preventing chronic infection and liver cancer and death in small children. So hepatitis B is still, though, endemic in a large portion of the world, where children can get this virus, through any type of blood-to-blood contact, but in particular from their mothers. Other risk groups would be people who are, say, sharing IV drugs, for example, or if you are at risk for needle stick injuries, for example, healthcare workers. Now, this virus, again, has a pretty long incubation period. The overall incidence of chronic infection is relatively low, 5 to 10%. However, this is dependent upon age. So if you do get infection, it might be asymptomatic, or you might have an acute infection. The acute infection is pretty similar to hepatitis A, but you also have joint pain. And then some of those patients will go on to develop chronic infection that can lead to scarring of the liver, cirrhosis of the liver, and then chronic inflammation can lead to cancer. And if you go on to develop a chronic infection, it's fatal 15 to 25% of the time. Now, I said this is dependent upon age. So very small children, the chance of chronic infection is like close to 80-90%. Then as the child gets older, the risk of chronic infection goes down dramatically. So for us college-age students, or for, your professors, me, if I was infected with hepatitis B now, the chance of chronic infection for me would be quite small, but the risk of chronic infection in my children, for example, would be really high, 80% or more, which is why the hepatitis B vaccine is so important. You get the hepatitis B vaccine, and after the first couple boosters in childhood, it's near 95-98% effective. That immunity does wane as the child gets older. Very small children, when they're vaccinated, frequently that immune response is not lifelong, it fades over time. And so they're now recommending that when you get a little older, to have a final booster for more long-lasting protection. But this is really dependent upon age. Young children, much more susceptible. All right. Now, you might be asking yourself, hepatitis B is a DNA virus. It doesn't have an integrase. So how does it integrate and lead to cancer? And if you're asking yourself that question, very good for you. So hepatitis B does not have integrase. You are absolutely correct. So how does integration of HBV lead to cancer? Well, chronic infection with hepatitis B leads to chronic inflammation, and chronic inflammation leads to chronic oxidative stress. And so these cells are under long-term stress that can lead to breaks in the cellular DNA. And when the cell tries to repair itself, sometimes it can accidentally incorporate some hepatitis B DNA into the cellular genome. And then this leads to cancer. All right, hepatitis C virus. Now, this is interesting because it wasn't characterized until 1989. Now, this may have been around and circulating, but it wasn't documented, it wasn't characterized. So prior to 1989, you had hepatitis A, which was spread through contaminated water and food, and hepatitis B, which was blood-blood contact. And then you just had unknown hepatitis that was not A or B, so it was known as non-A or non-B hepatitis. And so in 1989, they were able to isolate the genome of hepatitis C and start studying it. And then in 1992, they were like, oh, this is a big problem. And then that's when they started screening blood supplies for hepatitis C. Hepatitis C is a big cause of cirrhosis of the liver and potentially liver cancer. So here is a healthy liver, and here is a liver with hepatitis C. Now, this has a really long incubation period, perhaps even decades, where you may not experience any symptoms. And this is found around the world. It is a big problem all over, and almost 2% of the U.S. population is estimated to be infected with hepatitis C. The incubation period, several weeks, and then it starts infecting or it starts replicating in your liver, and again, you can be asymptomatic for sometimes decades. And this leads to cirrhosis of the liver in a large percentage of patients, 55 to 85%. Now, there are some antivirals to treat this, but a lot of these people wind up needing a new liver. They wind up on the transplant waiting list. All right, hepatitis D. Hepatitis D requires hepatitis B. So hepatitis D is defective. And it can only cause active infection if you're co-infected with hepatitis B. So if you only have hepatitis D, you're fine. If you have hepatitis D and B, it makes hepatitis B much, much worse. Now, the symptoms, the signs and symptoms of hepatitis D alone are kind of nothing. But if you also have hepatitis B, it's just bad hepatitis B. And you don't really know you have both unless you're screened. You have an ELISA or they look for the genome of hepatitis D. Now, this is spread through the same mechanisms as hepatitis B, but the biggest risk factor for this is IV drug use. And in fact, depending on where you live in the world, between 39 and 90% of IV drug users are positive for hepatitis D. Hepatitis E is endemic in large parts of the world, thankfully not here, but in large parts of the world, Asia, Africa, and in the regions of these areas that have a lot of poverty. This is rare in industrialized nations, and this is also less common. So remember, Africa is a huge continent with lots of different countries. Asia is also a huge continent with lots of different countries. So within these continents, hepatitis E is going to be more common in the more impoverished areas. Though this has been found outside of these areas, it's less common. So here we think transmission is almost entirely through contaminated water or food. Spread from person to person is very rare or unlikely. 40-day incubation period, more severe than hepatitis A. Higher mortality rate, and this is particularly serious for pregnant women. The other thing that's different from hepatitis A is that there's evidence that it's zoonotic. So here is a diagram for transmission, right? So with hepatitis A, it's just people and contaminated water. But with hepatitis E, we think it might be in other animals, camels, pigs, deer, and then the fecal material and waste from these animals from agriculture can also get into the water supply and infect people. Now, this is a picture showing you some conditions that people commonly live in. And people are poor and This is their reality. So here you have people who are washing up their dishes in the river. Children back here are playing or bathing in the river. You've got a fish market here, and some of the fish may have come from this river. Here's a public latrine. Here's the public latrine sewage. And then garbage from the larger city is just dumped into the river. And for a very long time in human history, we had this, the solution was dilution. And, if all of the waste went into the river would carry it away. That only works if you have very few people. If you've got a big city and lots of people, that doesn't work at all. And so these people are trying to clean their dishes and, practice hygiene, but it's kind of impossible because in the water where they're washing their dishes, there is sewage from the public latrine. A big problem in a lot of the world is they don't have proper toilet facilities. And a lot of people might have an outhouse, but that outhouse backs onto the same water source that they are using for other things. Or people might be using this river also for irrigation. And so that gets into their fresh fruits and vegetables. So adequate sanitation and adequate toilet facilities would go a really long way in preventing hepatitis E, but also a lot of other illnesses that are transmitted fecal-orally. And then we've got the non-A to E viruses, and again, these viruses, we don't really know that much about their clinical significance, so we're going to kind of gloss over those. All right, we're going to pick up here in part 2.